Hello all, I am Dr. Archana Daftardar. I am a consultant nephrologist at Renova Hospital, Kompally. Flank pain. So what is flank? Flank is the area between the ribs and the hip on the back side, that is the lower back. Usually patients will tell my kidney area is paining, so that is called as the flank area. So whenever there is a pain there, it is called as a flank pain, and whenever the pain is severe, it is an emergency. So why the flank pain happens? Flank pain can be because of the muscle sprain, or because of the rib pain, or because of the kidney problem per se. Muscle sprain can be because of jerky movements. Patient will give the history, or patient himself or herself will know whether there is any injury, trauma, twist of that side to cause the pain of the flank. So this is a milder or not much serious cause of the flank pain. Coming to more worrying or most important cause of the flank pain is the pain arising from the kidney. The flank pain can be present bilaterally, or usually it is present unilaterally, that means one side flank pain can be there. Patients who are having both sides stones can have bilateral flank pain in presence of infection, or whenever the stone passes through the ureter down. So, two important conditions of the kidney here are the stone and the infection of the kidney. In the stone, whenever the kidney stones are of less than 3 mm size, they pass it with very mild pain because the size is small. So patients may not notice it many of the times when they pass the stones. But usually 3 to 5 mm stones, they have little difficulty in passing the ureter because the diameter of the ureter is smaller. So whenever the stone passes through that ureter, there may be some dilatation or the distension of the ureter causing the pain to the patient. So this is the course when the stone takes from the kidney to the bladder out, then the stone can cause distension of the urinary ureters and can cause pain. So whenever as the stone bigger, the more the pain will be, and many of the times the stone gets stuck there in the urinary pathway, and there is a blockage to the urine passage. So at that time there is accumulation of the urine up, and there is a distension or the swelling of the kidneys, that is called as hydronephrosis, and that gives rise to pain. So whenever there is a stretching of the kidney tissue, there will be pain in the flank. So this is what is related to the stones. Coming to infection. So as I said, whenever there is a stretching of the kidney tissue per se, there will be pain. Otherwise, a small stone sitting inside the kidney will not cause pain. The infection arising from these stones can give rise to pain in the kidneys. So that is also one of the very important causes of the flank pain, and it is called as, whenever there is an infection in the kidneys, it is called as pyelonephritis. So the inside the kidney, the urine remains and the bacteria gets multiplied there, they enter to the systemic blood flow also, and causing local damage to the kidney tissue also. So this is a pyelonephritis causing the pain. So whenever there is a pain, the patient seeks attention, medical attention, and as per the history, the investigations will be done. One of the important investigation here will be the ultrasound abdomen to check why there is a pain. So in that we will know whether there is a swelling of the kidney, whether there is any big stones which are seen, as well as whether there is any infection. At least we get definitely a very good idea about these conditions on the ultrasound abdomen. Sometimes when the stones are small, or when we need more details, then the CT scan abdomen or the non-contrast CT of the kidney ureter bladder, that is KUB, NCCT KUB, will be advised to you to know more details about the stones, about the blockage, about the kidney size, and about the infection. So depending on the kidney size, depending on the nature or the look of the kidney, as well as the site of the stone, the size of the stone, the treatment will be different for each patient. So it is important to seek the medical attention in this case. The other investigations like blood investigations to check your kidney function, your blood count, are also important during the evaluation. Urinary testings like CUE, that is complete urine examination, urine culture to know more about the bacteria of infection will be carried out. So, depending on the patient's symptoms and particular patient scenario, the tests may differ case to case. So, coming to the treatment of this, first whenever you have pain and you go to hospital, you will be given injectable painkillers to reduce the pain or to give you some relief from the pain. And once during the evaluation, we have to see whether there is any associated vomiting or fever, then accordingly the antibiotics or the antipyretics, antiemetics, all these injections will be given, and IV fluids also will be given to hydrate you as per the patient's hydration status. And then after evaluation, when we know the exact cause of the pain, accordingly the surgical and the medical management will be carried out for the stones as well as for the infection. Thank you.